presentation portion of our hospital indemnity program on how to present this product when you're out in the sales field. So what I want to do today here is take about 15 minutes and go through my presentation with you. It's a very simple presentation, highly effective if you'll kind of go on the guidelines that I give you here today. So what I have on the screen here in front of you is the scope of appointment form that we get a lot of requests for. People want a copy of this. This is a form I've been using for about 4 years. I had one that had November of 2010 on it, laid out a little different than this, but basically the question that always came up and said, can you sell a hospital indemnity time at the same time you sell a Medicare Advantage plan? So this scope of appointment discloses hospital indemnity. As long as it's disclosed on your scope, you definitely can sell that at the same time that you sell the Medicare Advantage plan. So with that, what I want to do is I want to show you how I present the product, how I train other agents to present the product, and kind of share some feedback that after the end of the webinar from some of the guys that actually do this based on what I show them and how effective it can be if you will kind of add it to your portfolio. So the first thing I do, guys, it doesn't matter if I'm showing a Coventry, a United Healthcare, a Humana, an Essence, any of the little sideline MA plans that are out there in different pockets of the country. They're all formatted identical. The first column on the left is your inpatient hospital care. So when you click that, or when you come to number 3 on any company's summary of benefits, it's going to say inpatient hospital care. So the second column describes how original Medicare corresponds to inpatient hospital care. And the third column describes how that Medicare Advantage plan that you're either reviewing or showing corresponds to the inpatient hospital care benefit. Today I'm using Coventry. That's a very popular product here in Kansas City, Missouri. And so that's the one I'm using. Now, before I get started into the presentation, I take my legal pad and on the left-hand column of my legal pad, I write you pay, and I underline that. And when I hit a benefit of this product, I put it in there, or when I hit an area that's going to cost them money out of their pocket, I write it right under the you pay column. So when I come to number 3, which is inpatient hospital care, they're going to talk about how this plan corresponds to what happens should that individual go into the hospital. So I say to the prospect, I say, well, you know, Mr. Jones, if you're in the hospital days 1 through 7, you are required to pay a $250 per day copayment. Now, Mr. Jones, what that means is if you're in the hospital for 7 days, you are responsible for $1,750. And then I will say to Mr. Jones, but don't worry about that. I'm going to show you why you're not going to end up paying that. Now, just don't let me forget it, okay? So I've created an amount of money that he's responsible for, which he is if he's in the hospital 7 days, $1,750, and I let him know that I'm going to show him how that's not going to affect him, and I've asked him to remind me at the end of the webinar or at the end of the presentation not to forget it. Okay, now I take that $1,750 and I write it into the first line right under the you pay column. I move on to number 4, 5, 6, all the way up until I come to number 14, which is the ambulance benefit. And I say to Mr. Jones, I said, now, Mr. Jones, if you're in an ambulance, you're going to end up having a $200 copayment for the covered ambulance services. Now, that ambulance is going to take you right onto the emergency room, and when you get in that emergency room, most plans today have a $65 copay for Medicare-covered emergency room visits. So I take the $200 and the $65 copayment, and I write it right underneath the $1,750, and I say to my prospect again, now, again, Mr. Jones, don't worry about paying those ambulance copayments or the emergency room copayments, because I'm going to show you how you're going to get away from not having to pay those. Just don't let me forget it, okay? And I go right on through that summary of benefits. When I come to number 18, which is the durable medical equipment, I say to my prospect, I say, now, Mr. Jones, any MA plan out there for durable medical equipment that I've ever seen always charges 20% of what Medicare covered items, what Medicare says the item should be. So at this point, I'll take my legal pad off to the right of my you pay column, and I'll write total on the same line that the you pay column is, and off to the right of that, I will write approved. Under the total, I'll write $1,000. Under the approved, I'll write $500. And I will say to the prospect, I say, now, Mr. Jones, let me just ask you a question. Here's what the durable medical equipment charged, but over here's what Medicare said they should have charged. Now, Medicare will pay 20% of one of those. Which one do you think it will be? Well, of course, I've already given him the answer because I told him of what Medicare said they should have charged. They'll point out to that. I'll take 20%, write that right under $500. That comes up to $100. I transfer that $100 over in the you pay column underneath the ambulance and the emergency room copay. I draw a line under that. I add it up. In this case, it's $2,065. And I say, just in a little scenario like this, you're out $2,065. But again, I say to them, don't worry about those things. I'm going to show you why that's not going to affect you. Okay, at that point, guys, I completely go through their summary of benefits. I go all the way through the tier 1, 2, 3, 4, and 5 drugs, explain how those work, the donut hole, the complete ball of wax to him. And then I simply fold that summary of benefits up, and I say to Mr. Jones, now, Mr. Jones, that's how your current program works. Do you have any questions for me? Well, what do you think Mr. Jones is going to say after I've reminded him 3 or 4 times to remind me not to forget something? He immediately will say, well, yeah, Bill, you were going to show me how I wasn't going to end up having to pay some of those charges. And I thank him. I say, now, you know what? I'm glad that you reminded me that. I was getting ready to do something, go on to something different. So, guys, here's the key with selling multiple products at the same time when you're in a home without sounding like a greedy insurance salesperson. You got to have some transition phrase that will take you from the Medicare Advantage plan to this plan, the Secure Advantage Hospital plan, very smoothly. So if you will learn this transition phrase, it's about 7 lines, it's very easy, you will find out that this is a very, very smooth transition. So what I say is, Mr. Jones, back when we first started selling Medicare Advantage plans in 2005, they all had an effective date of January the 1st, 2006. Now, nobody, including me, knew how these benefits were going to be paid out. Now, what we learned after a couple of years, our clients started paying a lot of money out of their pockets when certain scenarios took place. Let me just ask you a couple of quick questions. See how simple that is? I've prepared him to ask me how not to have to pay these charges. He's now asked me that, and now I'm giving him a transition phrase into our product. So you can change this around, like if you weren't selling Medicare Advantage plans until last year, you can simply say, well, Mr. Jones, when our company started selling Medicare Advantage plans back in 2005, you can just, gear it to your own personal situation. If you'll use a transition phrase along these lines, you will move from the MA plan to the Secure Advantage plan smooth as silk. So after I say, let me ask you a couple of quick questions, here's now what I say to him. Mr. Jones, let me just ask you this. Have you ever been in an ambulance? Now, guys, it doesn't matter if he says yes. It doesn't matter if he or she says no. If he says yes, you would simply say, well, Mr. Jones, where did that ambulance take you? If he would have said no, I would have simply said, well, Mr. Jones, if you were in an ambulance, where would they take you? So it doesn't really matter whether they have or have not. Your response is virtually the same. So 9 times out of 10, and I would encourage you to try this on somebody, they will say to you, they'll take you to the hospital. Well, that's correct, and I say, I understand that, but Mr. Jones, what part of the hospital? And then that's when they will identify the emergency room, and I say, that's correct. They're going to take you to the emergency room. I take my ink pen and I point back toward my legal pad, and I said, now, Mr. Jones, you just triggered 2 co-payments on your Medicare Advantage plan, the ambulance and the emergency room. So then I say to him this. Now, Mr. Jones, one of 2 things will happen while you are in that emergency room. First off, they may stabilize you and send you home, but if they're not able to stabilize you or they're unsure of your diagnosis, what do you think they're going to do? At that point, Mr. Jones will say, they're probably going to put me in the hospital. That's when I agree with him. I say, that's correct, Mr. Jones. They will admit you to the hospital, and now that's going to trigger the most expensive part of your MA plan, that $250 for each day you're there. Again, I point back to my legal pad to get to $1,750, and then I simply turn that the brochure over, and on the back of it is the rate sheet right there in front of you. And I say, now, Mr. Jones, this is why we created this program. At that point, I turn that brochure over. Right there are your rates. And now I can start figuring it into his budget based on the information he gave me prior to, going through the first MA plan. If he was coming off of a major medical and paying $400 or $500 a month for that, I come down to age 64 at $300 a day. That's $42.10. I can add another $29 to that for the lump sum cancer rider. That puts him at about $68 a month. If he's been paying $400 a month, I assure you he can afford $68 a month, and you have rounded off his benefit package to a very, very good program should he become ill in life. So guys, that's how I present the presentation, just some of the feedback I get. I do webinars for Douglas Mitchell out in Arizona. He uses this program just about to the T, like what I told you or showed you here today. He says he's closing 6 out of every 10 people that he shows this to. He is very, very committed to this product. I was doing a presentation for the Kingdom Group down in Thomasville, Georgia, at their summit, and one of the guys in the meeting said to me, he stood up and said, guys, this does work. He says it works so good I even forgot that I was supposed to set it up for him to remind me at the end, and the guy that was not, he was doing a presentation for the guy's wife, and the guy was in the other room listening. He said he got up and he walked back in there and said, I thought you were going to show us how not to have to pay some of these co-payments. And he said, oh, yeah, I forgot. And he actually did forget. So it does work. It's a very effective presentation. I have given it to companies, sat down with companies, large companies, SMS over in Columbia, Missouri. Absolutely love this transition phrase. They use it all the time. So it will work. If you guys will kind of learn this along the way, if you need this presentation, let us know. We can email it to you. Here is a product availability of where this product is available. If you are in the yellow states, we'd like for you to write it on Heartland National. If you're in the blue states, Equitable Life and Casualty offers it there. So we got about 44 states covered between the two companies. My name again is Bill Ellsworth. You can get a hold of me at my email address, bille@e-hfg.com, or you can reach us here at 1-800-373-4000 and ask for Gershon Georges. She's our marketing manager. She will get you what you need. Again, folks, I appreciate you taking time to listen to this today, and if I can ever be of service to you, please don't hesitate to call or email. Thanks so much. You folks have a great day and a great AEP.